First, I would like to say thank you to the European Public Health Alliance and especially to Radost for the opportunity to share some reflections from our experience at the community level. Over the last years, we've collaborated very closely with Roma women in neighborhoods here in Sevilla. And the presentation is based off of our experience, our framework, and also for this presentation, we've included the voices of the women that we've collaborated with in my presentation. Well, I can outline at least what I'm going to talk about. First, I'm going to be speaking about the challenges and opportunities for participation. Oh, here we go. Perfect. Thank you. So I wanted to highlight some challenges and opportunities for Roma participation, but from a community-based lens. First, I wanted to speak about the consequences of the absence of Roma participation in generating evidences and participating in research methodologies and advocacy work. This is many times Roma communities have played a secondary role, and both in the tools and methods that we utilize in research are exclusionary and are not defined by community priorities. And many times the representation is overcast by larger Roma organizations or non-Roma researchers and professionals. And the consequences are programs and policies that Roma communities do not identify with. And of course, this causes a perception in the majority society that Roma communities are helpless. And this system of science and evaluation is just replicated in an oppressive system and has caused marginalization. And the consequences of marginalization at the local level is the high perceived sense that Roma people sense this abandonment from services and public services, and has caused fragmentation between institutionalized resources and resources that are important to the community. We recently did a social network analysis of in two local contexts of the resources available to the community. And what we saw was that there is high density in Roma faith-based organizations and small grassroots organizations where there is high Roma participation, yet fragmentation with institutions where resources are being invested. Of course, this has its silver lining in the fact that this proves that Roma have a high capacity of resilience and resistance at the local level. And I wanted to kind of echo a little bit what Roland was saying before of COVID-19. We can't overlook recent events and the consequences, and I think it reflects well these challenges and the opportunities at the same time. We all know the living conditions of many Roma communities, and I don't want to generalize. This is my experience here in Sevilla and my team's experience in Sevilla. But during the pandemic and during emergencies, NGOs and local teachers in these neighborhoods provided emergency supplies, such as food, but as soon as the intense lockdown measures ended in Spain, those services were absolutely abandoned when we went back to a new type of normality. And recently with schools opening, many families did not want to send their kids back to school because the protocols were developed without Roma participation, not even at the public schools in their neighborhoods. And many families did not trust the schools. It was very symbolic to them. The non-Roma professionals for them, combined with the fear of COVID-19, did not want to take their children back to school, and of course have been blamed for not having a culture of education and have been even threatened by social services and law enforcement to take their children back to school. But yet many families have resisted together and have both not taken their children back to school and slowly over the past weeks together have decided to take their children back to school. So this reflects the influence and recognition that Roma have at the local level. And if we could go to the next slide, please. So the question in our framework tries to answer is how can we ensure that Roma have opportunities to develop sociopolitical influence and recognition at the local level. And so we linked together two main ideas, like you can see in the diagram to the left. In the outer circle, that is an advocacy process, and in the inner circle is sociopolitical development. So I wanted to define quickly what we consider sociopolitical development from a community-based definition, and that is the community gaining a deeper political understanding of discrimination and the political nature of health inequities. And sociopolitical control has three main pillars. First is developing critical knowledge, building critical knowledge with the community through methods that engage in conversation, in reflection, and connecting their daily experiences and building a theory and developing evidences around their daily experiences to challenge existing evidence. Next is expanding their social support. So not only within their families, but also expanding to local organizations, faith-based organizations, healthcare professionals, researchers to support in advocating based on those evidences. And lastly, taking action in local advocacy work together with that social support. So we understand advocacy as a way to develop sociopolitical control for marginalized communities. Next slide, please. So I wanted to just highlight some key ideas for what does this look like in the day-to-day practice. And first, that policies, anti-racist policies and practices should follow trauma-informed care. That means developing real relationships, so stakeholders, non-Roma professionals, Roma professionals, non-Roma, Roma people together, building real relationships based on trust. Not only is it about the community sharing their experiences, but also reflecting on, for example, for me as a researcher, what is my identity and how do I play into the methods and the evidence that we develop together. This also implies changing the role of different stakeholders, that horizontal relationships such as Roma NGOs, developing evaluations that considers the community perspective, especially more invisible parts of the community, and providing that peer support and bridging those different types of alliances that organizations do have. Next is recognizing that Roma community has the capacity to represent themselves when given the opportunities and the tools to do so. And finally, as a researcher, we have the civic responsibility of providing those resources and tools and supporting advocacy based on leadership of Roma people. And finally, promoting synergies with existing policy initiatives, for example, current local COVID-19 stimulus plans, which is what we're trying to do now here in Seville, and other larger plans, such as those directed towards climate change that Rados had mentioned earlier, and also including influential actors from the community in that participation. Next slide, please. And for the purpose of this participation, I'm not Roma, and it was important to ensure that the voices of the women that have collaborated with us would be a part of this space. And so for the purpose of this presentation, I had a conversation with 7 women, and I asked them, what challenges do you have as a Roma woman in defending your rights? And if you were standing in front of EU policymakers, what message would you like to say to them? And so based on those narratives, I developed 4 main priorities together with them. The first is that they want and need resources and opportunities to advocate. Without that, there will be no progress. And that this is a chain of events. Not only is it the mothers I work with, but their children and the parents, and it's a generational for their physical and mental health. Second is to recognize an intersectional approach. Roma women experience several forms of discrimination within and outside of their community. Third is a Roma recognition, not only how non-Roma perceive them, but working in a horizontal way to be recognized in a different, in a equal way, and also building trust with one another. And finally, changing the perception that they're capable of change, working at the local level and small actions with the support of non-Roma to resist normalizing unjust living conditions. And that is the end of my presentation. Thank you very much.